I'm Beth Menges, again, been at Linden Oaks for 25 years, been doing this for 30 years. So this is an outline of what we're going to talk about, and like I said, some of it I might go through a little bit quicker because to me it's just more clinical, and I'm not sure what you guys really want to learn today. So we'll go through some of that. We'll definitely look at the current trends that we see and what we're kind of seeing locally going on too within the community. My biggest my soapbox is everything going on with cannabis use and the legalization of cannabis and dispensaries all over creation. So I will talk a little bit about that today too. I do have 2 kids. One will be 23 and one will be 20. And so I've kind of lived through some of this experience myself. Obviously, when I started 30 years ago in the field, I didn't have any kids. And when I first started working with adolescents, it gave me a much different perspective. And now that I've had to live life with adolescents into young adulthood, it doesn't always go the way you think, like as a therapist, like just do this and this is what's going to happen. So I'll share some personal experiences I've had too with my kids. This is just our objectives. We want to be able to understand kind of stages of substance use, the current trends, gain knowledge about marijuana, and then understanding strategies to help keep kids safe. So 3 stages, this is kind of very much a general overview. So one of the stages is experimental use. And so this is just someone trying something a couple times. Maybe you're at a party and your kid's like, hey, I'm gonna, you want to try smoking pot, you want to take a pill, you want to do something. And maybe they try it once or twice and they're like, I don't like how this makes me feel, I don't want to continue to do that. That's really experimental stage. Social use is when you're getting more into regular use. Maybe you're at a party on the weekends, most weekends, or a few times a month, and you're starting to use more regularly. That's going to be social use. And then problematic use is when you're getting more into having consequences. I liked how, if you were downstairs in the keynote, and she talked about not so much, I think Ryan might have talked about it actually, not so much how much time you're on a screen, but what are the consequences of that? What is it getting in the way of? And we really do look at substance use very similarly. You can't say exactly like, do you drink every day, do you use every day, that makes it a problem. You have to look at what areas of your life are being affected. And obviously for kids, is school being affected? Are they unable to go to school? Their peer groups, are they getting into legal problems? Things like that. And if we're starting to see more of that, then the substance use is probably a little bit more significant than just experimental or social use. These are officially like a DSM criteria if we were going to diagnose someone with a substance use disorder. So I'm just going to go through a few of these. And so using more of a substance than you first intended. So if you're out at a party and you maybe have no intention to use, or you're like, you know what, I'm going to have 1 drink. But every time you say you're going to have 1 drink, you end up having 4 drinks or 4 shots, whatever it might be. Trying to cut down or stop your use and not being able to do so. The biggest ones, though, are spending more time getting it and neglecting your responsibilities. Those are the big ones we look at. Again, home, work, school. Even in treatment sometimes, especially with our adults, like on Mondays they call in sick, and it's like, well, because they were drinking over the weekend still, even when they're trying to get help. So that's the bigger thing to look at is what are the consequences. This is interesting to me because these are some signs of teenage substance use, but these are also just signs of being a teenager. And so it's like, how are we supposed to differentiate? Are you just being a normal kid, or are you experiencing some substance use issues? So again, poor hygiene, change in appearance, glazed or bloodshot eyes. Most kids don't have that unless they're probably using substances or maybe staying up really late. Weight loss, weight gain. Mood changes and irritability. Again, that's really difficult because a lot of adolescents are pretty moody a lot of the times, even without any substance use. But probably some of those behavioral signs too: isolating, staying in their bedroom, locking the bedroom door. Change in the friend group is probably one of the biggest signs that you'll see. And because, again, these other things you're going to see in an adolescent anyway. They're usually going to isolate a little bit, want to be hanging out in their bedroom, not spend a lot of time with family all the times. But that change in friends will be one of the areas that we can really look towards to see that something's going on. This is just a nice SAMHSA, is a Substance Abuse and Mental Health Association through the government. This is was a nice little flyer they came up with, which kind of says what was on the last slide. Mood changes, school problems, rebellion, change of friends, nothing matters kind of attitude, the presence of alcohol or finding other paraphernalia in their room, and then maybe other physical or mental health problems starting for them too. Overall trends. So synthetic drug use is on the rise. It's been on the rise for a while. One of the most common ones you probably hear about in the news a lot is fentanyl. I don't really feel like a lot of adolescents per se are like, oh, I'm using fentanyl. But a lot of times as they're using pills, especially if they're getting pills off the street, you don't know what's in. They might think they're doing a Xanax or a Valium or as they call them, Xanax bars, and there could be fentanyl cut in that, and they don't know that. DuPage County coroner, for I think it was last year's data, every overdose that happened in DuPage County, fentanyl was involved in every single overdose that was there. And usually like 3 substances were found in people. So a lot of times you think you're using one thing and it's cut with like 3 things. So I just think kids have to be really, really careful of this. So personal example, my son, again, went to, I think, a rave last weekend. He's never gone to anything like that before. And I was like, please just don't let anybody pass you anything. Like, please, if you're going to have a drink, make sure it's the drink you did. He's underage. But again, I'm like, if it's going to happen, just make sure you got the drink. No one else put anything in the drink. Don't take any pills from anybody. Like, just trying to educate how dangerous that can be because you just don't know what's going to be in it. Research chemicals, there's a wide variety of research chemicals that have these long, unbelievable names. Some of them you can actually buy at like the gas station, and they're supposed to be like, oh, this is going to pep you up and it's a little stimulant to keep you awake. And you can buy this stuff. And we have some of our young adults coming into treatment that have been abusing these substances too. So again, some of this stuff is really legal because how they make the chemical, it doesn't really fall under an illegal chemical compound. Something else we found is, and I'll show the graphs in a minute, is we've actually seen the biggest dip in substance use for adolescents over the last few years. And I know I'm probably jaded in a way because the people I see in treatment are the people struggling. So I feel like, wow, this is really a huge problem. But we do think that with COVID and kids not being in school and the access and things like that probably have something to do with the drop we're seeing. If we continue to see that drop, that's wonderful. But again, there's been a pretty dramatic decrease that we've not seen since 1975. So, which again, looks really nice, but we want to see if this kind of holds out. I do think 2022 data just came out, but it's very general right now. They haven't broken it down per substance and things like that. So again, we see significant decrease in alcohol. So the teal bar is 2020, the orange bar is 2021. So looking especially at 10th and 12th graders, we've seen a dip with alcohol, and we've also seen, especially with the 10th graders for marijuana, we've seen a really significant dip in the use of marijuana. Again, from what I see in treatment, this doesn't really add up to me. This doesn't seem accurate, but this is what's being reported in the, for the Monitoring the Future survey that the kids take each year. Vaping trends, they're even showing that vaping has been going down. I know hearing from teachers and social workers and things like that in the school, like it is a huge problem in the schools. The kids are going in the bathroom and they're vaping in the bathroom. They're doing it in class because they have these smokeless vapes and they're like pretending they're coughing. They do it right in treatment. They're in our treatment program and we're like, okay, we know what you're doing. We can't search them. We can't go through their pockets. So it's really easy to bring that stuff in. But again, it's showing trends are going down. The other thing, the second bullet point here is after marijuana, prescription medications are by far the most abused medication. And part of this reason is easy access. Most people, if you've had a surgery, have something done, you save that prescription like forever and it's in your medicine cabinet. Kids, a lot of times, that's the first time that they're using is you're going into your cabinet at home, they're going to a friend's house and looking through that medicine cabinet and being like, oh, there's a benzo here, Xanax or Valium. Maybe someone struggles with anxiety in the household and they're taking this medication. Or maybe there's a narcotic or an opiate from a dental surgery or another medical procedure you had done. It's really important to, if you're not taking those medications anymore, to dispose of those medications. Most places like CVS and Walgreens now have boxes you can do that. Edward Hospital, right by the emergency room, we have a box that you can just go ahead and dispose of those, because that's usually first use for kids of prescription medications is usually from their own household or someone's household. So here's some other data that was shown, and this is through the National Institute of Health. And so again, they're showing, this is for daily in this left corner here. So 12th graders, daily vaping 11.7%. So not a huge percentage. I know from being involved in the school systems in the past, I'm losing the name of it now, that they like to also flip that around and kind of say, well, if it's 11.7%, and let's just go with 11% are using, that means, 88% are not using, or 89% are not using. So it is important to also realize that it's not necessarily a huge percentage, but it definitely is an issue for kids. And then the e-cigarettes over here, high school students overall, the data that was most recent was the 2019 and 2020, and again showing that decrease in middle school. And I think looking at just vaping and really going back, some of you are aware of like looking at nicotine, right? When nicotine was legal, and then many years when we had all the lawsuits about it, and like, you know, way back when, I think it was in the 70s, when it went before Congress, and it was like, oh, it's fine, it's not addictive, it's no big deal. And I feel like we're reliving that exact same cycle again when we look at vaping and when we look at marijuana use. And I'm kind of nervous to see what's going to come of that. Vaping was brought about to help people that were using nicotine kind of slowly get off of nicotine, but right away they figured out like, wow, we can market this to our kids and we can have cotton candy and all these flavors. And so it definitely has been marketed more to kids, and kids are using it on a regular basis. What's interesting here is, so the little cigarette is the cigarette use, it's really cigarette usage, and just look at the difference between vaping. So most of these kids are like, oh God, I want to smoke a cigarette, that's awful. But you know, vaping is not that big of a deal in their minds. Here's what they all kind of e-cigarettes look like. So again, they're very small, something that can be handheld in their hand, something in pockets that you would not find. So again, just kind of seeing some of those pictures. The nicotine content, one of those, this is Juul, which was a brand, and there's some lawsuits now with Juul because of this, but one of those pods equals a whole pack of cigarettes. So if someone uses a pod a day or a pod every couple days, they're smoking a pack of cigarettes. Again, it looks like, oh, it's only this little bit, but the level of nicotine. What's also interesting to see is in Europe, the maximum, the very high rate of nicotine is, I think, like 16 or 17, but the Juul content is up to almost 60. And so that was legal in the United States to be using. And I know it's been back and forth right now in regards to it was taken off the market and back on the market. And since Juul, there's just so many more different products that you can use for vaping. But it's interesting to see the difference, what Europe is kind of what's high already and where we're at with the Juul pods. These are some signs of vaping. It smells really sweet. It smells really good. It's kind of funny because when we have our adolescents in treatment, like they have to go to the bathroom. And after they go in the bathroom, I'm always like, I'm going in there doing a sniff test. And some days I'm like, well, it was a girl in there. Did she spray some perfume? Like, I don't really know. The one day I did know for sure when they vaped marijuana in there because I thought I was going to puke when I walked in the room. It was so strong. That sweet smell becomes really, really hard to be able to sometimes know for sure what it is. And for us, at least in the treatment setting, it's really, you know, we can't accuse them of doing that. So we have to be able to ask, like, hey, did anyone do this? Does anyone have it in their pocket? We've caught them before passing it. Same kinds of things I'm sure are happening in the school system at this point too. But again, if you smell a lot of that sweetness, that's probably a sign that they're vaping. Irritability, if they're vaping on a regular basis, they could be getting more irritable. And a lot of times this is a sign of nicotine withdrawal. And this was interesting to me a couple years ago when we would sit in our treatment team meetings and people would say, well, the parents are concerned that Johnny's going through nicotine withdrawal. I'm like Johnny's 15, really? Nicotine withdrawal? And then I realized with all the vaping going on, there's such a high content of nicotine that very much so these kids are starting to experience nicotine withdrawal. We have kids on a nicotine patch now. We have kids that we give nicotine gum to help them get off, stop vaping. So definitely that irritability. Extreme thirst, a lot of times it can lead to dehydration. So a lot of times you'll see them maybe drinking more water or drinking probably more energy drinks or something. Nosebleeds can occur also, again, the dehydration, drying out the nose. Bloodshot eyes is another sign. Caffeine sensitivity, again, you're already getting this level of kind of caffeine, anxiety, jittery, and then if you're mixing that with other caffeine or other energy drinks, which, again, a lot of adolescents are drinking energy drinks. And persistent cough, again, what it's doing to your lungs. I mean, anything that you're going to put in your body. Even when it first came out, the kids were like, well, this doesn't contain anything. And I'm thinking, but you're inhaling something into your body. This is not something that can be healthy in the long run. So this is a campaign that the DEA has for fentanyl, and it's a One Pill Can Kill service campaign. And when you pull up like the link that I have there, it just pulls up, you might have seen it in the news, like this rainbow, these pills that look like little Skittles and things like that. And again, just really showing how much that is marketed towards kids because they're colorful and they look nice and they look pretty. Or even a lot of times when we start talking about the marijuana, the edibles and the gummy bears, and if a parent is using that and they're in the home and the little kid sees it, we've had situations where small kids end up in the emergency room because they're taking these things because they look like candy. The other thing about fentanyl, and we're working actually really hard to get this at the hospital, most common drug tests don't even test for fentanyl. So if someone comes to the ED and they overdosed and they do a drug panel on them, the opiate or something might come up, but then the fentanyl doesn't. So they don't even know that they've experienced maybe fentanyl use. And so we're working with our emergency departments as well as our treatment programs to get fentanyl added to our drug panels. Because I think that would be a very telltale sign for somebody to be like, oh my God, I didn't realize I took something that had fentanyl in it. So this is a little bit more trends we're seeing in the area. Someone asked that before. Cannabis, huge with our adolescent population. It's huge with every population, quite honestly. Our young adults, our adults coming in, using cannabis, kind of across the board, we're seeing a ton of it. And a lot of times as people come in, more so our adults, they might also have a problem with alcohol or other drugs, and they're very willing to stop the alcohol or the other drugs, but they're like, I'm not gonna stop using cannabis. And so it can be just as problematic as other drugs or alcohol can be. But for the kids, definitely, we see that. Nicotine, alcohol, Xanax is a huge one. Again, that's a benzodiazepine, so that slows things down for them. Very similar kind of to alcohol, but you're going to have a faster reaction to that when you're taking those pills. We are seeing a little bit more with some of the psychedelics, with mushrooms and LSD. Again, we don't see it a ton, but there are kids that are like, oh yeah, I've experimented with that, I've tried that a few times. So we are seeing that too. And then some of the opiates, codeine, again, because that's just something that a lot of people have in their medicine cabinet, and it's around. So codeine is a real popular one that sometimes they use. And then DXM, which is dextromethorphan, that's in a lot of the cough medicines you find. And so a lot of times now those are behind counters and you can't just buy a bunch of it. But there's kids that will just come in, they just drink the bottle of cough syrup. And then when they drink the cough syrup, they feel high and they feel under the influence. Again, very drowsy, very groggy, things like that. If they're mixing that then with other substances, it can have serious side effects for them. But that if you're seeing a lot of like, wow, you went through a lot of cough medicine with your cold or don't even have a cold, that might be another sign that something's going on with substance use. So yes, my marijuana is addictive. There's so much like, oh, it's not really addictive. It is hugely addictive, especially now with all the different strains you can have and the different potencies and consistencies of marijuana. People will have withdrawal from marijuana. So the psychological addiction is more obsessed, feeling like I have to use it, I need to have it. Euphoric recall, like, wow, when I was high, that felt great. I love how that made me feel. I want to feel that way again. That's another sign. Change in behavior or schedule so they can accommodate smoking, maybe being out of the house more. Gravitating towards people who do use marijuana and just even smoking just to feel normal. So that's pretty common when someone actually has a substance use disorder, is they have to use that substance just to feel normal for the day. And then a physiological addiction, loss of appetite, difficulty concentrating, disruption of sleep pattern. So again, as kids are coming in, especially in treatment for us, when we see them coming off of marijuana, they're usually very irritable, they're struggling with sleeping, things like that. So those are some of the signs of the addiction for marijuana. Here's some interesting facts that I think we don't really share in the news a lot. We share that THC, the main chemical in marijuana, and CBD, and all like, wow, these are all these miracle drugs that are going to cure every little thing you've ever had. But obviously cannabis use at a younger age makes you more vulnerable to other addictions later in life. So, it's just marijuana, no big deal, but becoming addicted to other things later in life could be a bigger deal. A lower academic achievement, definitely they see a decrease in points on IQ tests. So we do know that long term, there are lower academic achievements and higher risk of dropping out of high school. If people start using marijuana before the age of 18, they're 4 to 7 times more likely to develop a cannabis use disorder as adults. or more so than adults, excuse me. So I know for my kids personally, again, I'd prefer they not ever use drugs. But I was like, if you can try to get to 18, like please just get to 18 before you do this, because I know there is definitely a larger chance of that. And in our own family history, we have alcoholism on both sides of the family too. So we did a lot of education with the kids growing up, and we started with nicotine because they had grandparents that died from lung cancer. So we were able to kind of start there and move forward with some of it. But again, they've definitely both experimented, I know, with marijuana. So I'm hoping that doesn't go any further. Cannabis hyperemesis syndrome, I don't know if anyone's heard of this. So this is from long-term cannabis use or even shorter-term cannabis use with the really potent marijuana. It's uncontrollable vomiting. We have had adolescents as well as adults that have been hospitalized because of this, because of dehydration. And of course, like you're bringing your family member to the emergency room, like something's got to be wrong, and they run all these tests and nothing's wrong. It's because of the marijuana that they're using. Again, we are not seeing it a ton, but it's definitely something that's happening. And we had one adult that for 3 weeks was in and out of the hospital because of this. So it is something that we do see. And lastly, I've seen this a good amount, THC can trigger psychosis and psychotic episodes. And again, we don't hear about this in the news very often. I think in research, if you're looking at it now, there's more research about it. But for about 5 years, I worked on our inpatient unit, and we had so many young adults coming in with first episode psychosis that were using marijuana every day or taking edibles and using high THC content marijuana. So again, not going to happen to every person, but it does happen, and it's a real thing. And I think sometimes it gets dismissed in the media. Again, another personal story, didn't lead to this for my daughter, but my daughter one day came home after a weekend. She was at her dad's, and she's like, God, I was out Friday night. I got so sick Friday night. I vomited like 3 times. And so I'm like, did you get drunk Friday night? She's like, no. And so I just left it alone. I wasn't even thinking. She was a senior in high school at the time. And she went back to school on Monday. And then on Tuesday, I get a call from the school nurse, and she's like, you know, your daughter came. Something just doesn't seem, she's not feeling right. She's saying like her perception is completely off. And so I'm like, okay. So I go and pick her up, and she gets in the car, and she just starts bawling her eyes out like, oh my God, I smoked pot on Friday night. I've never smoked pot before. And so come to find out, she probably used something that had a very, very high THC content. She vomited like 4 or 5 times that night. And then 3 or 4 days later, still felt like these weird effects. She just like, I just didn't feel normal. And so she has learned after still wanting to, I was actually kind of happy. Like, I'm glad you had a really bad experience because you're probably not going to want to do this again. I do know she's almost 23 now. She's told me she's tried it a couple more times. She realized like, I can't do this. I get paranoid. I have just a really, really bad reaction. And this is not something that I want to do. But again, just really showed me like, yes, when you're using this for the first time and using these high THC content, what can happen? So here's, again, why we're seeing issues. Ease of access, social media, it's everywhere. All the billboards down 294, wherever you're driving, 88, all the cute little names for all these marijuana dispensaries. I still have to, I can't bring myself to go into one, but I should, just so I kind of have firsthand more information about it, but I just can't bring myself to go into one at this point. But it's everywhere, and it's just kind of like, it's just marijuana, what's the big deal? And that's a problem. Back in the 80s, the average potency for THC was 4%, and now the average is 15%. That's still very low because the cartridges, the THC oil, that's 70 to 90% THC. And then edibles can contain 50 to 90% THC. I remember probably like 5 years ago, maybe a little longer than that, I think it was at Central, there was a few kids that ate like a bite of a gummy bear and ended up in the Edward ED with really like anxiety symptoms. They all got sent home, nothing really serious, but their heart rates increased, they got really anxious, people knew something was wrong with them. And that was just taking a bite of a gummy. And so sometimes what happens too with some of the edibles, more like the brownies and cookies, literally the packaging says like, take a bite. Well, most people, when you got a cookie or a brownie, you're not taking a bite, you're gonna eat the whole thing. But you don't feel the effects right away, so you think, oh, I need more, and then once you put more in, you have no control, it's gonna take over, and it's, so again, they are highly concentrated with THC, and people have to be very careful of that. The top slide there is something they call dabbing, and it's like a wax that they burn, and that's very, very potent and high concentration of THC also. And kids that are doing this stuff, this is the language they use. Like I don't do groups and things directly with the kids anymore. I manage the department, but I still hear it. I miss what I could learn from the kids because they knew all the new language and everything that was used, and you would learn a lot, actually. I don't think I have it on here too. Flower, the flower part of the marijuana is, again, very highly concentrated. And so I think what people used to just call, I smoke pot or smoke bud or smoke that, now they call it flower. So if you hear people talking about flower, that's probably what they're talking about. So I did go on a couple of online sites. And so if you have time, if these don't pull up, it is pretty amazing going on there and just seeing like what's available. I mean, and you go on and it just says, are you 21 or not? Okay. And then it pulls up all of this stuff and it talks about the concentrations and looking at the names of it and seeing the first one. It's like, looks like, you see, I'm sorry. It looks like sugar. It's scary. And I think the other thing with some of this with marijuana is just seeing it again across all ages. I know I've talked to people that are like, yeah, my 40, 50-year-old women friends, they're like, yeah, sure, I take edibles. And so many people take edibles to sleep and it could be helpful. So I don't want to say like everything about it is going to be awful, but you have to be really, really careful. Kind of another example, just personally, and in my family, my younger brother never drank. But probably like 3 years ago, he's like, well, marijuana's legal now. I started to use edibles. So I try to think, well, if I go out and have a couple of glasses of wine to have fun, and he doesn't drink and decides to have an edible to have fun, is that the worst thing if you're being responsible about it and you're not driving and doing that? Probably not. So I'm trying to expand my mind a little bit and be more open-minded. But when we come to how this is, thank you, how this is, oh, that's okay. When we come to how this is advertised for kids, I mean, banana train haze. Can you go back up just a little bit? Because those are some, I mean, that looks, I would eat that. It looks like candy. I mean, the other stuff does not look like candy. But it's very, and it really tells you right there how much THC is in it, 50 milligrams. So if you have a chance and you just want to Google marijuana dispensaries, you can pull up and just kind of look through some of this and see what's available. And you can see what the different strains mean. And you could learn a lot about the different language used and things like that. So yeah, here's all the gummies, yeah. And again, if you're especially either a kid using this or an adult using this and you leave this around at home and you have a younger sibling or a child that's like, wow, I want some chocolate today, and they're using something with 100 milligrams of THC. And emergency rooms have seen this. When it first got legalized in Colorado, they saw an increase with poison control and people coming into the emergency departments and things too. And I think going back to kind of what was talked about in the first presentation today is really trying to look at their values and going at it from this, like, is this really how you want to show up? But I think sometimes for certain kids, it's, again, they're kind of in this experimental stage. Some people are already down the rabbit hole and they're more addicted to it. There's a lot going on in their family. There's a lot of pressure at school. I mean, there's so many other things underlying it for some of it. And sometimes it's more of just that rebellion and kind of like, screw it, I'm going to do this right now. I think what's difficult, what I've struggled with over the years with adolescents, is how much of it truly is it's a substance use disorder and they're truly addicted, or is this a phase? And again, they're using it regularly and it's problematic and it's causing problems, but how many of them maybe grow out of that phase after a couple years and be like, oh, I mean, I know people personally that have been able to do that were really kind of rebellious, running away from home, using drugs, and now they're like 22 and they're like, well, now I have a job, I work full time, they're not doing that stuff anymore. But I think just treatment, trying to get treatment, trying to have the social workers talk to them, but I think hands are tied. Like our hands are tied to in treatment. Like I said, we can't be like, let me see your pockets. Did you use this today? I think sometimes too is probably educators and parents. I mean, sometimes then the parents, some parents are very much like, I don't, go ahead, search my kid or pulls. We can't do that. Other parents would be like, why did you do that to my kid? That wasn't fair. And so I think hands are really tied. I mean, it can be very, very difficult for sure. I think, again, education, there's some great materials up here. I think there'll be enough because Sam only had 10 on talking to your teens about marijuana use. I think the biggest thing for me as a parent then, and being in this field for many years, is I tried not to like freak out, right? Like having a conversation of, hey, I might want to try, well, let's get information. You know, overall, it's probably not a smart thing to do really, because sometimes you don't know what you're getting and what the potency is. But just, I think being aware, and especially if there's addiction within the family, making sure you're educating, like you have a higher likelihood that you could become addicted to substances if there's alcoholism or substance use disorder in the family. And just continuing to educate as much as possible. I think that's kind of where I've been, at least for my kids. My son, I know, has used probably marijuana more than my daughter has, but I also then looked at, he never really liked school, but he got through school, he's in college, he's doing, it didn't really affect other things, so I was like, okay, I am not going to kind of take this, oh my God, stance, because that would probably push him the other way. So we just have conversations about it. But it's difficult, and I think these kids getting in these groups where it's just like this is what's being talked about and presented all the time, it's difficult for them to say no to this stuff, and if it's going on at home. I don't know how many 16, 17-year-olds are like, well, I smoke with my mom or dad. Like, well, now we're calling DCFS. This is just stuff with adults, clear rules, consistency, checking up communication. Kind of what she talked about downstairs really for social media is the same thing in regards to this. Setting boundaries, setting rules, following through with rules is really, really important. I think, and again, this is interesting because it's kind of an oxymoron. Keep an eye on social media, but respect their personal boundaries. And it's really difficult to be like, how much am I going to keep an eye and still respect their personal boundaries? And so it can be difficult too. But I think really, I know this is a very short session. It's more so just to, get online, look at stuff, get some education. Just look at, marijuana dispensaries or things like that to get education about it. Again, there's SAMHSA is a great resource. The Center for Disease Control is a great resource to get other information that isn't just what all the big marketing agencies that work for these dispensaries want to put out all this wonderful stuff about it. These are the places that you're going to kind of get some of that other information too. So I would encourage you to take some of that today, and if you have time at home to kind of look some of that up too.